I did my PowerPoint on a patient that we had last week come in that had dextrocardia. He's a 50-year-old male. He complains of syncope episodes, and he passed out prior to completing his stress test. His history includes dextrocardia, dyslipidemia, family history of CAD, and an aortic murmur. Symptoms included was episodes of syncope, chest pain, and shortness of breath. His current medications he's taking is Lipitor, Zoloft, beta blockers, and he was loaded with 600 milligrams of Plavix prior to the heart cath. He also had a TEE, a carotid ultrasound, and a cardiolite stress test, which he could not complete because he passed out before the cath procedure. So we took him to the cath lab. We attempted to access the right radial artery. We had a hard time getting the catheter into the arch the correct way because it was backwards due to the dextrocardia. So we decided to go through the right femoral artery. We had to use a Judkins left coronary catheter to cannulate the right coronary artery. We also had to use a Judkins right coronary artery catheter to get to the left coronary artery. Here's the left ventricle. The picture on the left shows the chamber before it pumps, and the one on the right shows it when it was squeezing, so you can see the aorta. We also did a right heart cath to help us determine the cause of the syncope episodes, so we went through the right femoral vein. Picture's not very good, but we did an angiogram of his pulmonary arteries. We had a difficult time getting the catheter up there. This is a angiography of his right ventricle, so you can see the balloon on the swan. His saturations and pressures. The saturations in the right atria were 62%, right ventricle 53%, PA 58%, AO 91%. His pressures were elevated in the right atrium, right ventricle, and in the pulmonary artery they were a little lower, and the left ventricle and the AO were normal. His cardiac output was 3.81 liters per minute. Just little notes about the case: we had to use opposite catheters to get to the coronary arteries that we normally get to. So the right for the left and the left for the right. Our findings were he had very low O2 sats, but he had elevated RV and RA pressures. The doctor determined that he had severe pulmonary stenosis, which was decreasing the amount of blood going to the lungs and decreasing the amount of O2 getting to the brain, causing his syncope episodes. We both agreed that he would benefit from either a valvuloplasty or a pulmonary artery replacement. The end.